Welcome to Field Notes, Insights from N2Public Health Alumni. N2Public Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, N2Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making.
Joining us today is Aaron Winden, Public Health Specialist, Strategy and Planning from Walworth County Department of Health and Human Services, Division of Public Health. Aaron graduated from the N2Public Health residency program in September of 2023. You had a pretty non-traditional path into public health, Aaron. Can you tell us more about how you found yourself in your current public health role?
Yeah, first, thanks, Mackenzie, for having me. I'm looking forward to this and really excited to talk about my time in N2Public Health. And I'm also excited to share this journey, which has been fairly non-traditional to get into public health. So before entering the public health field 2.5 years ago, I spent my entire career in social work, working with adults with severe and persistent mental illness, and then later in an administrative role as a privacy officer at Health and Human Services here in Walworth County. I have both a bachelor's and master's degree in social work, but like I said, my path has been anything but traditional. While I did provide clinical care in my past, my true passion has always been working on community and leadership-focused initiatives. I've always enjoyed collaborating with partners and stakeholders to tackle really those big picture challenges. And a few years ago, I found myself in my previous role in an office that left me really missing the community engagement. So when a position opened up at our health department, I felt like it was a really perfect opportunity to be able to transition back into more of that community role and be able to make a change at that level. So since joining Walworth County's Public Health Department in June of 2022, I have really just loved every step of that transition. It's been incredibly rewarding, and I'm excited to talk more about it with you today.
Great. And I think you made a great point that a lot of folks maybe don't realize that the work of the health department is to engage with the community on a very high level. Can you share some examples of the current work that you're doing at Walworth County Health Department?
Absolutely. As I mentioned, my current role really fills that community work void that I had perfectly. So my primary role is overseeing the community health assessment and improvement plan, or better known as the CHA and the CHIP process that most local health departments have to go through. Depending on the time of the year and where we are in that CHIP cycle, up to 90% of my time is spent on CHIP related work. For example, we're launching the next iteration of our CHA this summer, so summer of 2025. Right now, nearly all of my focus is on preparation for that. This includes our survey design and methodology, forming a steering committee, assessing our ability to procure secondary data, and coordinating with local hospitals as we conduct a combined CHA and community health needs assessment for the first time. So each hospital system has to go through a very similar process called a CHNA, or community health needs assessment. So at this time, I'm wrapping up work on our current CHIP cycle, which concludes at the end of 2025. So really straddling the how do we continue to be engaged with the rest of the CHIP cycle that we're currently in, but also look forward to what is that next CHIP, CHA and CHIP going to look like. When I'm not working on our CHA and CHIP, I love contributing to our budding health and all policies program. Our supervisor that I have here and I have been navigating this area together. One of our first formal tasks early in 2024 involved researching and educating our Board of Health on Delta 8 and its impacts on youth in our county. This led to collaboration with the rest of Health and Human Services leadership, law enforcement, and our corporation council, in addition to our Board of Health and County Board of Supervisors. One more, I guess, exciting project is I led a survey of county park growers to gather input on improvement, usage, and just demographics of who is using our county parks. This was in partnership with our Department of Public Works. And since then, we've worked on revamping park kiosks, installing trail counters, and launching an Art in the Parks initiative. So really, that's where local primary school students will compete in an art competition, and selected pieces will be displayed along one of our trail systems at mile markers. And while this isn't a formal policy change, it's a creative way to engage students, encourage park usage, and celebrate their achievements.
Awesome, Aaron. That's such a cool project with the parks, and you've just really shown us the variety of work that public health can take on. Even just one role, you do so much different types of work activities. Can you share a little bit how the New to Public Health residency program helped contribute to the work that you're doing now?
Yeah, so New to Public Health was really an incredible launching point for me to start understanding everything that I missed out on not having that formal education focused on public health. As I said, it was all social work. But I think I was lucky in that the path I chose in social work was more of that micro level social work change and not directly the consumer care. Again, even though I did work in consumer care, that macro level policy and leadership stuff that I did learn within social work really helped my transition into public health. But then New to Public Health really filled everything else that I missed. So each month's modules really expanded my knowledge on those key topic areas like environmental health, communicable diseases, emergency preparedness, communications, maternal child health. So really all of those key components of public health that I may not have been exposed to unless I was an actual employee in public health or had really more intimate knowledge about what each health department does. So New to Public Health was really key in giving me that really firm knowledge base. So while our public health department has a very strong onboarding program, New to Public Health allowed me to really dive deeper into each of those subjects. And I think what I found most helpful was the scavenger hunts that you all had us do every month. It really gave me that chance to apply what I was learning, whether it meant exploring Walworth County public health policies or meeting with program staff to discuss their specific roles as well as just different topics and how they do their work, whether it's day to day or what some of the long-term goals of their program are. So being that very definition of New to Public Health, this residency was exactly what I needed. It really spurred my desire to keep learning even after that year was up. And now I'm actually about halfway through my N2PH program at UC Berkeley. So go Bears. Thank you so much, Aaron, for your time and for the work that you do for Walworth County. And yeah. Of course. Thank you for having me. And, again, I appreciate all the work that you're doing with those new public health employees, whether it's transitioning them into just learning more about public health or getting more ingrained into their role, their specific role. So like I said, New to Public Health was a great launching point for that, and it really built that foundation. So thank you.
Thank you for listening to Field Notes, insights from New to Public Health alumni. For more information on the New to Public Health residency program, visit new2publichealth.wisc.edu. Thank you.